Welcome back to the show. This time of the year has a lot of people cashing in on their sick days, curled up on the couch with a box of tissues and just feeling miserable. Well, we're more likely to get sick during these cold, dark days of winter, but there are some things we can do to protect ourselves. And here to give us some tips is Dr. Swetha Kandula and Dr. Rene Romig, pediatricians with Community Healthcare, which is also this segment sponsor. Thank you, ladies, for being here today.
Thank you.
Thank you for having us.
So, Dr. Romig, what can people do to reduce the risk of their family getting sick this season?
Mm-hmm. Well, here's some recommendations, starting with just some basic things. So first of all, try to minimize any exposures to sick people or crowds, but I realize that's not always possible in school or daycare settings.
Yeah.
So in those instances, make sure that everyone is washing their hands frequently.
Yep.
Also, keeping up to date with your regularly scheduled doctor's appointments is important. That way you can maximize the control of any chronic medical issues and make sure you're as healthy as possible. And finally, eating healthy foods, getting some exercise, and doing those healthy habits will boost the immune system and help you fight off infections.
Yeah, definitely some good tips there. Who is recommended to get the flu vaccine, and who's at higher risk for complications from the flu?
Yeah, I recommend the flu vaccine for everyone starting at age 6 months.
Okay.
Some people are in those higher risk categories. So people with underlying medical issues like asthma, heart disease, any conditions that weaken their immune system, and then also young children, especially under 2, and older adults are at higher risk. But it's important to remember that even perfectly healthy people can be at risk for complications, and those can be serious, like brain inflammation, seizures, pneumonia. So that's why I recommend it for everyone.
Definitely.
And then also getting the flu vaccine will not only protect us, but protect the people around us who might be in those higher risk categories.
And it's still not too late to get the flu vaccine,
correct,
right? Yeah, okay. Dr. Kandula, talk to us about RSV. This is also very common during these cold winter months. How worried should I be if my child tests positive for RSV?
So RSV it stands for respiratory syncytial virus. It's one of the most common respiratory viruses in the US. Most commonly it causes symptoms like a runny or a stuffy nose, cough, sneezing, and fever. But in some individuals with risk factors, for example, infants younger than especially 6 months of age, or with history of prematurity, or heart condition, chronic lung conditions, or a weakened immune system, it can cause bronchiolitis or pneumonia and may lead to a hospitalization.
Yeah.
And if your child tests positive for RSV, you don't necessarily have to panic, because RSV in most cases is mild cold-like symptoms. But if you have a young child less than 6 to 8 months of age, it's a good idea to get checked out with your pediatrician to make sure that the child is stable enough to be taken care of at home. But if there are any symptoms like trouble breathing or anything, or decreased eating, lethargy, way less active than their usual, then they should seek care immediately.
Go see the doctor, definitely. Cold symptoms, those can range from mild to severe. So when should someone get help from the doctor or go see a doctor?
So usually cold symptoms, if the child is otherwise eating, drinking okay, they're a little bit active like their usual, the cold symptoms can last anywhere from 1 to 2 weeks, but they can still be taken care of at home. Parents can really do things like a lot of fluids to keep their kids hydrated. They can use a cool mist humidifier in their room to make them feel comfortable, and fever reducers if there is any fever. But if there are any signs of fast breathing, shortness of breath, excessive wheezing, prolonged cough to the point that the child is not able to eat, drink, and is very sleepy or lethargic, they should definitely seek care immediately.
Okay, so if your child is feeling sick, how long should they stay home from school or daycare?
So in general, we do recommend that kids should be fever-free for 24 hours without using any medicines that could lower fever, so ibuprofen or Tylenol. Symptoms should be improving. They should be able to eat and drink without any problems and be back to relatively baseline energy level. Specifically for COVID-19, there are some nuances there, so if that applies to your family, make sure that you consult with your doctor about what's best for your child, and then also you can check the CDC website for the most up-to-date information.
Gotcha, okay. What are some of the local patterns for respiratory viral diseases currently and even last season?
So currently we are most commonly seeing respiratory viruses that are from the rhino-enterovirus group. A little bit of COVID virus is actually going up again, and there are some adenoviruses. We haven't started to see the spike of the RSV or the influenza yet.
Okay.
But last year around this time of the year, we actually had 2 peaks for the RSV. We had an early peak somewhere around July and August, and then we saw a second peak around late October to November that lasted until the end of January.
Okay.
And flu also typically starts around, last year it started around late December to January.
Okay. And we talked a little bit before we started this segment. You're already seeing some of these cold symptoms.
Yes.
Is that early for this year, or is that pretty normal?
Pretty typical
Okay.
that around this time of year we start to see those symptoms
Yeah.
pick up.
Yeah, all right. Well, wash those hands, cover the coughs, right?
Yes.
And stay away from anyone who's sick, right?
Yes.
All right. Well, doctors, some great advice. Thanks for coming in today.
Thank you for having us.
Again, this segment was sponsored by Community Healthcare, and for more information, you can give them a call at 563-336-3000, and you can also check out chcqca.org. And we'll also have all those details posted on ourquadcities.com.